In other news now, sidelined during the COVID-19 pandemic, tuberculosis, the country's deadliest disease, has been working undercover. We look at the impact now of lockdown interruptions on TB patients' treatment. Also, we explore how Sizwe Hospital here in Gauteng is dealing with drug-resistant TB. Joining us now is Dr. Rianna Louw, the CEO of Gauteng Sizwe Hospital for Tropical Disease. Dr. Louw, thank you very much for your time here on eNCA. Welcome to today. I mean, TB continues to be a killer in our country, and because of the pandemic, it's sort of been sidelined. How bad has the situation been?
We can definitely say that as a result of lockdown and the COVID epidemic, we've seen from Sizwe a reduction in the numbers of patients that were admitted. But we also know that it's not just from our side, it's also countrywide. We're the only specialized hospital in the Gauteng province, but we also know that there's other specialized hospitals in the rest of the country. So indeed, the numbers has reduced. Reasons for that, one can say that the symptoms for COVID and for TB is more or less similar. So we are of the opinion that when people had a cough and they felt tired and they had fever, people were not tested for TB or drug-resistant TB for that matter, but for COVID, and therefore there were not the necessary tests done for tuberculosis. So that really resulted in the reduction of the numbers, but we also know that the health behavior, the health-seeking behavior changed. We also know that it impacted on tracing. It's a very, very long period to take tablets and medicines, specifically when it's drug-resistant TB. It can be up to 2 years. People do stop their treatment, they interrupt their treatment. There is a process in place where those patients will be traced. But unfortunately, as a result of COVID and the lockdown, some patients were not traced and could not be traced. So we will say generally, it's really what we have seen is that there was a delay in diagnosis, there was a delay in treatment, and therefore where there were complications where patients needed to be sent to a specialized hospitals like ourselves, there was also a delay. And unfortunately, that definitely resulted in patients in the community who probably were not diagnosed and who were not referred. We know indeed, as you said, that TB is still a public health crisis. And therefore, we want to certainly say that COVID is not behind us, but still in the light of COVID, we need to make sure that we concentrate and go back to the basics in terms of prompt diagnosis, prompt treatment, prompt referral. And I think one thing that we can say that's positive, although I've now, listed some of the negative impact that it had, I think we can still positively say that the resources were still available. So it's not as a result of resources that were not there.
At least really at least there's a silver lining to it all. The resources are still there, but there's been all this other impact. Now the country has made some progress over the years in the fight against tuberculosis, especially drug-resistant tuberculosis. So with this kind of impact that you've explained just now, Dr. Louw, what's likely to happen in future? Should we brace ourselves to see a rise in TB in the country?
Yes, certainly so. I think we as Sizwe expected that, and I think we've also seen it already happening, basically probably because of the fact that people now access health services in terms of clinics and hospitals again for diagnosis and for treatment. But also, I think we also from the Department of Health in Gauteng, we have made an effort again to reach out as Sizwe Hospital to the different clinics and the districts, where we then really also highlighted the fact that we will have to all take up this fight again to make sure that we get people promptly diagnosed. And
what about children? What about children? What about affected children? What are you seeing there?
Yeah, absolutely. Children, we have not seen many children admitted during the COVID pandemic. And that was very serious for us because certainly there's still adults and there was definitely missed adults. And if you also think about the lockdown where people were in their houses, you would expect that there would be children that would have also got drug-resistant TB or just general tuberculosis. And unfortunately, we did not see them diagnosed. And that, I think, is also one of the aspects that need to be looked into very drastically, is also, again, the diagnosis and the tracing, contact tracing of adults, for us to pick up the children so that we can also give them the specialized and necessary treatment that they deserve.
Thank you very much for your time and, of course, highlighting the challenge that the country is facing. That's Dr. Rianna Louw, the CEO of Gauteng Sizwe Hospital for Tropical Disease, the only hospital in Gauteng that treats drug-resistant tuberculosis, just flagging that it is the country's deadliest disease, killer disease, and it's been sidelined due to COVID-19, not because of lack of resources, but because people didn't access the facilities due to the pandemic. Now, she says, please, we need to change that and attend to the TB as well.